I have seen cases where I think one of the main causes is that they were on really high doses of methylfolate and methyl B12. Those can aid in the release of mercury systemically when your body kind of naturally sequesters them off. And also cases of people that are perhaps unnecessarily avoiding oxalates like the plague. And oxalates are going to chelate and help bind up heavy metals in the gut and good metals too. So there's obviously a balance. Some of the referrals, especially from certain clinics, have a recurring theme. And patients tell me, yes, I saw Dr. So-and-so or nurse practitioner so-and-so, and they're not sure what's wrong. They've narrowed it down to two things. And there is a 99% chance it is one of these two things. It's either heavy metal toxicity or tick-borne illness. And if it's a different functional medicine provider, it's either mold toxicity or tick-borne illness.
So we could call this the functional triad, because these are three things that are very commonly discussed and diagnosed, perhaps overdiagnosed, likely overdiagnosed in functional medicine practices. Because when a traditional workup doesn't reveal an underlying problem, then sometimes providers are incentivized to grasp at things that are not really there, which is not a great business model. I mean, it's a business model, but it's not great for patients or the reputation of, functional medicine, which means we're not really sure what it means at this point. It means a lot of different things, but true functional medicine is heavily grounded in evidence, or should be.
The root cause, finding the true root cause and addressing the true root cause where possible. And we don't need to go into the strengths and limitations of testing for these various conditions, heavy metal, tick-borne illness, and mold toxicity. And yes, we both certainly do have patients that do have these pathologies as well. Part of that is selection bias. So patients that select us are kind of often even more far down the, dysfunctional medicine algorithm. They've seen multiple, not only conventional medicine providers, but alternative medicine providers. And I wouldn't even say that we necessarily prefer patients like this, but we are happy to help anybody that might seek out our services. So yes, we're not trying to invalidate someone who does have one of these pathologies, but we've very consistently seen this as a common theme among people who go to those clinics. Just like if you seek out, say, a fibromyalgia specialist, you might end up with a fibromyalgia diagnosis. It's similar to that.
Yeah, and the chronic Lyme is interesting because this is actually an infectious disease, technically. I suppose mold toxicity is a bit of an overlap between either infectious pathology, because certainly you can get fungal lung infections, versus a mold allergy that's causing the symptoms. But chronic Lyme, it'd be interesting to listen to infectious disease physician who is well-versed in this area, perhaps even on this podcast at some point. And the heavy metal toxicity is interesting because if you are seeing a functional medicine provider, just run-of-the-mill, probably going to be on quite a few supplements, and it almost
like methylfolate
makes it more of a reasonable test to order, because you're taking a bunch of supplements which may or may not be contaminated with heavy metals.
Yeah.
So the more supplements you are on, the more high yield of a test heavy metal toxicity is.
I have seen cases that have true heavy metal toxicity, often mercury, where you see that enzymes that are cofactored with selenium are interrupted as well, even hematologic abnormalities. And I have seen cases where I think one of the main causes is that they were on really high doses of methylfolate and methyl B12. Those can aid in the release of mercury systemically when your body kind of naturally sequesters them off. And also cases of people that are perhaps unnecessarily avoiding oxalates like the plague. And oxalates are going to chelate and help bind up heavy metals in the gut and good metals too. So there's obviously a balance. But both of those cases we have seen.